All right, there we go. Okay. There's construction going on in my house, so I am stealing a spot in my daughter's bedroom. So here I am. Welcome to Chai with Cheruba. This Thursday, we're going to be talking about a really fun topic, and I'm just waiting for people to join in. Please let us know where you are coming from, and also grab your cup or mug of chai and we will get started. Um, so, okay, invite a friend to join in and let's get going. Okay, so today we're going to be talking about a really important topic, and it is about navigating second opinions. Um, So, as a surgeon, I deal with this a lot. And so I want to unpack this a little bit more. And our health is just so important. It is not something that we want to leave to chance. Oftentimes, um, procedures, surgeries, they're one in a lifetime, right? As a surgeon myself, for me, it's not because I do these all the time. But if I flipped over to the patient perspective, you are getting a hysterectomy once in your life. You are getting a robotic myomectomy once in your life, hopefully just once. Um, but those are big decisions. These are not things that you want to take lightly. Or maybe you are having to face the decision of, should I be on this medication that's going to give me all these side effects? So these impact your quality of life, and you really, really want to have certainty as much as possible and feel confident and reassured that you are in fact making the right decision. So that's what we're going to be talking about today. When you should, how and when, and the art of seeking a second opinion so that you feel confident that you are moving ahead with the right treatment, right surgery, things like that for you. Okay, so I'm going to give you 3 points and we'll unpack those and then we'll take questions at the end. Okay. So, number one, when should you even seek a second opinion? So, maybe you have a doctor that you trust, you are going to them, you've been going to them for a long time, and now they tell you, oh, based on this, you actually need a surgery. So, do you just say, okay, great, like I'm going to do that? Or do you want to seek a second opinion? How do you know when? How do you figure out whether this is what you should go with or if you should seek a second opinion? So the first thing there is if you are facing a major diagnosis, okay? So this could be a chronic medical condition. In my field as a gynecologist, we're talking endometriosis, fibroids, pelvic pain. These are chronic things, PCOS. These are kind of things that we are dealing with for an extended period of time, or a cancer diagnosis, right? These are big diagnoses. So if you're facing a chronic condition or a big diagnosis that is surprising or not surprising, either way, that's going to alter your life course, this is a time to just seek another opinion so you are sure that you're doing the right thing. You also want to seek a second opinion if you are feeling rushed or dismissed. Just this week, I had a patient from another health system who said, my doctor told me I needed a hysterectomy, but I don't really, it signed me up for one. I've got my date. I have no idea what's going on. What exactly are they taking out? What is my recovery like? How much time do I need to take off of work? I mean, she had a lot of questions and she literally came to me for a second opinion on just to unpack what her doctor had already said. Um, so that made her then start to question, well, if my doctor didn't even have time to go through all these things, is this the correct surgery for me? Right. So if you feel like you are being hurried up and your appointment is so short and you're not really you really don't have a chance to ask questions, then it's probably a good hint that you need to seek a second opinion, because you don't want to feel rushed with that whole system, right? Like, this is a big thing for you, as I said, surgery, big medications, all that. Like, so it's not a bad idea to, at this point, seek a second opinion. Um, and then the other time is also when you feel like the treatment is rather aggressive or unclear. So you go in with a problem. I'll use fibroids because this is what patients come to me for quite frequently. Okay, Dr. Prabakar, I have a fibroid. And I say, you need a hysterectomy, right? Well, that's a little aggressive. Maybe that is the right decision, but there's a lot of things I need to talk to the patient about prior to that, right? Get a really thorough history, and then we'll hear all the treatments, hear the medical treatments, hear the surgical treatments, hear the pros and cons of each. If you choose surgery, here are the 3 different types of surgical options, and this is why you would choose one or the other, right? It's a very long discussion. You can't really just say, oh, you need this. So if you feel like, whoa, they just didn't even listen to me, and they just recommended the most aggressive thing, well, you may want to seek a second opinion. And again, at the end, you may arrive at the same conclusion that that first doctor may have said, but you now feel, yes, I am making the right decision because I have all the information, and now I can make a strong decision. So you definitely want to seek a second opinion if you feel like the recommendation is too aggressive, if you have a major diagnosis facing you, and also if you feel like you're just feeling rushed or dismissed. Okay, so that's number one. Number two is, how do you approach it, right? Now, this I think many patients find tricky. They want to get more information, but they feel embarrassed. They don't really want to tell their doctor that they're seeking a second opinion. Is their doctor going to feel like, what, this patient doesn't trust me, right? The patient often feels embarrassed. So don't feel those things. Like I said, this is your health. This is your, future, especially if you're facing a surgical decision. So you want to make the right one, and just be honest with your doctor. Hey, doc, that's great that, if you feel like you've given me a good idea, just to let you know, I'm going to just think about this, maybe get a second opinion, just so I know, what it is that I'm really getting into. So as a physician and surgeon, I always appreciate when patients say that. And that actually makes me feel good, because honestly, it makes me realize that the patient is really taking the time to understand things. They're just not going into a procedure willy-nilly. They really feel like, okay, this person really wants the information and wants to make the right decision. So I'm not offended when patients tell me they are seeking a second opinion. So don't be afraid to tell your doctor that you're getting a second opinion. And then also make sure you bring relevant information, right, to that second opinion. Bring your MRI, bring your ultrasound, bring your biopsy results. There's nothing more frustrating than when we get to a consult, the patient is paid for an hour long consult, and then I'm asking for, okay, so what was your imaging, where's your MRI? They're like, oh, like, I think I did that a few months ago, where did I do that again? And we're just wasting time. They're not getting the bang for their buck. And so if you're going to seek a second opinion, have some idea of what's going on from your previous doctor, from your first opinion, and then bring along any additional imaging test results, and have that all organized and ready to give to your physician, so that you can now, make really efficient use of that time. And also, be clear with why you're seeking the second opinion, right? So when patients come to me for a second opinion, they'll say, my doctor already told me I need this surgery, and I just want to hear from another person if this is really the right thing that I should be doing. So they're very clear. They're not, doubting their physician. They're not doubting themselves. They're okay with what they heard, but they just want some reassurance. They want to be confident that in fact this is the decision. Or you can say, well, I'm coming to you for a second opinion because I'm a little skeptical about what my previous recommendation was. So maybe you heard that you needed, a hysterectomy, and you're like, whoa, this problem just popped up, and I don't really think it's that serious, but this doctor is telling me I need a hysterectomy, and they're not really taking the time to, unpack it for me. So that's really why I'm here. I'm really here to, see if there's anything else that can be done, any other procedures, any other medications. So I just want to explore other avenues. So whatever the reason, just let your doctor know why you're there for the second opinion. And that helps us as well. When people come to me for a second opinion, then I'm like, oh, okay, this patient really needs the full breadth of information, or this patient just needs reassurance that, in fact, this is the right thing. And I'm going to tell them to trust their doctor and, go ahead with the treatment. So that really helps. Be clear for yourself, and then also be clear to whoever it is you're seeing. Okay. And then, um, thirdly, when you get to the second opinion, what kinds of things should you be asking? So this is going to be guided a little bit from what I just said about, what the purpose of why you're there is, right? Is it to just seek reassurance that what you're doing is the right thing, or is it to gather more information, right? So you always want to ask, is there anything else that I should be thinking about? Medicine is constantly changing. There are new papers and publications that are always coming out. There are new conferences that your doctors are hopefully attending, and really getting the most up-to-date knowledge. So maybe you did get information from a couple of different doctors over the years, but always ask, is there anything else that I should be considering for this problem? And it's a nice open-ended question. And when patients ask me that, I start talking to them about lifestyle options, and certainly, medications and surgical options, but I bring in a lot of lifestyle options that some patients have never considered. For example, endometriosis is a common one. Patients and doctors are so focused on, what medication should I be on for endometriosis? What surgery should I be getting? What's going to take my pain away? That no one's really talking about lifestyle. So when patients ask me, well, what else should I be thinking about? We have a whole conversation about, alcohol and what types of foods and the importance of sleep and the immune system. So we're really bringing in a lifestyle focus and aspect into the whole thing. And so be open-ended and ask them if there's anything else that you should be thinking about. And then also ask them about their experience in doing something. So if they say, I really don't think that this medication is the right one, I really think you need to do the surgery. And then you can ask them, oh, is this something that you've done a lot? Because maybe in your second opinion, you're going to find somebody who is even more robust or more skilled at doing that particular surgery. What has your experience been with this particular surgery? How many of them have you done? So these are not bad questions. I know they can seem a little awkward, and patients are always like, I know this is a little awkward, but I want to ask you, how many of these procedures have you done? I'm like, that's a great question, because you want somebody who's done a lot of those, right? Or maybe there's a new medication that the second opinion person is suggesting. Well, you can ask, like, what has your experience been with prescribing this medication? How have patients tolerated it? Have you seen success? So these are the questions you want to be asking in your second opinion. And so those are kind of my 3 points, while we discuss navigating second opinions. So again, how to approach it, right? And then also what to ask during a second opinion, and when to seek a second opinion to begin with. So these are really critical things, and points that I think we should embrace, because it's all about empowerment. You want to feel empowered. This is your health. To the doctor, this is their 100th patient that they're doing the surgery. This is their 1,000th patient that they're giving this medication to. But for you, this is once in a lifetime, right? And so for you, you want to make sure that you are doing your due diligence in ensuring that you are getting all the information that you need, and that you are in fact doing the right thing for you, and you're charting the right course of action for you. So I just love talking about second opinions, and I think it's really important that we are all empowered with this knowledge. So share this with somebody that you think could use it, and I'm happy to take any questions from anyone. How can you tell if your current provider's plan isn't the right fit for you? So, unlike maybe a decade ago, or maybe a couple of decades ago, now we have the internet, right? So, almost no one is coming into the doctor's office blind. When patients come to see me about anything, they've already read a little bit, they've already researched a little bit, they've already talked to their friends a little bit. A lot of topics are not taboo anymore, right? So, which is great. And so there's a lot more conversation about things. So no one is coming with zero information, right? So you have some information already. And if you feel like, whoa, this person's plans are just, this is like nothing like I've ever heard, like I haven't even heard of these things, that could mean that you want to dig a little deeper. Or I think the biggest kind of tip off for me is that they don't take the time with you to provide a very holistic kind of approach. And if they say, "Well, this is what you should do," and that's because I said so, that's always a little bit of a red flag to me, if you will. It is true that we've trained for years and years and years and years to do what we do, and so we have a lot of information, obviously, that the patient doesn't, but I think how you approach it is really, really critical. Meeting the patient where they are, seeing what they know, providing a kind of a wholesome picture, and then recommending is very different than if you feel like your doctor is not listening to you. So that would be the biggest red flag, I would say. What else? What are the most common reasons women seek a second opinion in GYN care? So, in my office, I routinely see second opinions for all surgical procedures. So, my doctor said, I need a hysterectomy. Do I really need one? My doctor said, I don't need to remove this ovarian cyst, but I feel like I do. So, help me. Um, my doctor said, there's nothing else to do for this, and it will get better as I age. Is that true? Right? These are the kinds of the questions that people ask me. So they're around fibroids, surgical procedures, menopause is a big one, um, endometriosis, and then what else? I think those are probably the four main ones. So menopause is another big one. I was told I cannot be on hormone therapy. Is that true? Or I was told that this is going to be dangerous for me and I should just wait it out. Is that true? So those are kinds of the topics that patients bring up. Okay, what else? I always feel there's no time to ask questions. How do I advocate for myself better? Good question. When you make the appointment, first of all, it's important to know who you're seeing. Okay. So, are you seeing the doctor who makes all the decisions? Are you seeing a nurse practitioner or a PA who may or may not be making all the decisions? So, sometimes what happens is you have bleeding, you've got fibroids, and you're trying to find out, do I need to take these out or not? Right? So the best person to to have that appointment with is the surgeon, is the doctor, not the PA, the NP, or whoever else. So be crystal clear when you are making the appointment who you are seeing. Okay. So if you're just in the information gathering phase, if you just want more information at this point, maybe it doesn't matter which provider you see. But if you are trying to decide between surgery and medication or two types of surgery, please see the surgeon. And if a place does not allow you to see the surgeon, you need to keep looking elsewhere. This is my biggest pet peeve because Patients are paying, you are waiting for an appointment, you're waiting for, 3, 4 months, then you don't want to get there and then be told, oh, you know, I'm not the one to make those decisions. And so when you seek the person who is actually making those decisions, you are getting a lot more information in a shorter amount of time. Okay, that's just the truth. Because all the nuances of the medical complexities as well as the surgical complexities can be given to you in 10 minutes versus somebody just giving you general information for 10 minutes. So that's actually the first step to really making sure you're getting your questions answered. Number two, ask how long the appointment is. When you make the appointment, how long is this appointment? Do you have 10 minutes or do you have 20 minutes? So, or do you have an hour, right? That's going to really help you set your expectations for how long this is going to be. If the appointment is 10 minutes, while you're on the phone with the receptionist, please make 2 or 3 appointments. Okay. Make an appointment for the closest one you can get, follow that up in 2 weeks and another one. I mean, I'm telling you, this is how you get your questions answered. I know this is ridiculous, but this is how this is going to go with a lot of corporate systems where you just have 10, 15 minutes and then they're out the door. You want to make sure that you're following up with more time for questions as you are processing these things. And then also write them down and think about some of these things for yourself before you also get there. Okay. So, for example, if you're somebody who has terrible fibroids, you're bleeding, you're in pain, you're having a miserable quality of life, you know that we're going to bring up hysterectomy, right? You know that's going to happen. And maybe somebody's already brought up hysterectomy to you. Just take a minute to think for yourself, like, is that a route I'm willing to go? Or is that a complete no-no? Right. And then you're going to focus a little more of your time on, okay, what can you do without a hysterectomy? And when you get there, you can say, I know hysterectomy is an option, but I'm really here to find out what other options there are. So you can sort of engineer, if you will, your time, especially if it's short. So hopefully those things help. Okay, what else? How do you handle it emotionally when two doctors give you completely different advice? Yeah, that is a hard one. I think feel for patients when they're like, "Oh, this is not what I heard," or "This is completely different," than what I heard. Um, I would say, thank yourself for seeking a second opinion because maybe this is an avenue that you never even thought of or that was not brought up by your first physician, right? So now you have more information. And then at that time I would probably seek another opinion. Nothing wrong with that. Seek another opinion and say, okay, I'm getting a couple of different responses here, different approaches, what do you think? Between 2 to 3 opinions, you're going to have your answer. Um, but I agree that that can be very confusing to a patient. But I think just knowing that and just thanking yourself for seeking that second opinion because maybe this is going to take you down a completely different road. Okay. Yes. What else? What other questions? Can second opinions delay your care and is it worth the wait? Um, Excellent question. I think it depends on what you are deciding on. Okay, so if you're having heavy bleeding, for example, and you are lightheaded, dizzy, and you run to the doctor and they're like, take this pill, it's going to stop your bleeding. I would just go with that, right? That's not something to do a second opinion on. But if you've had endometriosis for a long time and now you're okay, you're like you're getting to your wit's end with this and you've dealt with it for years and you want something final and something a little more permanent and they say, okay, I think you should do a hysterectomy. Maybe that makes sense to you and you're like, yeah, I've already done all the meds, I've already done the lifestyle things, I this is not, I've already done having my kids, I'm done, I'm ready for hysterectomy. So when that doctor says, you need a hysterectomy, you're ready. You don't really need a second opinion, right? And you'll know if you're like, yep, that's what I was waiting for. I was really hoping she would say that. And when they said that, you're like, great, sign me up, right? But if you've just been diagnosed with endometriosis, You're 30 years old, never had any kids, you're trying to get more information. You go to your doctor and they're like, you need a hysterectomy. Well, that's a little extreme. That goes back to my first point that I brought up today, which is, if the treatment seems a little too aggressive or extreme, you're not going to say, sure, sign me up. You're going to say, what? Really? Like already? Isn't there anything else I could try? Right. And then at that point, it is worth waiting for that second opinion. So it really depends on how dramatic the recommendation is, and what your personal journey has been with it. If you've been dealing with it for 10 years and you knew that at some point you're going to need a hysterectomy, and that's what they say, well, it's going to resonate with you versus if this is the first time you've heard about it and somebody says you need a hysterectomy, right? That's not going to resonate with you. So you'll know when you need to seek a second opinion. And not all second opinions are out there for 3 to 4 months. In our office, we see patients the same day or the next day. And so call around, find an office that can see you. Because yeah, nobody wants to wait another 3 or 4 months to find out if this first recommendation was correct or if they should follow that. So call around, find out other models and other practices that can see you quickly. We're in the Bay Area, and like I said, we see patients the same day or next day. We have availability for that, and that's how we've structured our office. So it is possible. I was told they might have to do a hysterectomy, which really got me scared. No kids yet. Okay, so this is a perfect um, opportunity for a second opinion, right? Where you're like, oh, they may have to do a hysterectomy. I don't have kids. Seems like a lot. Now, there are times when we have recommended hysterectomy, even for somebody with no kids, and that may be the right decision for you. But again, that's a big decision. And this is a time I would seek a second opinion just to see, is there anything else that we could try? Is there anything else that could help me? So yes, that is a time for second opinion. Anything else? We have a couple more minutes. Happy to take any more questions. I love these questions. And please share this episode with a friend, a family member, anybody who is going through a tough time and figuring out, should I go see somebody else? Are second opinions covered by insurance? Second opinions are just like any other visit. So if you see an office that takes insurance, absolutely, your insurance should cover it. There's nothing special about a second opinion. In our office, we are out of network with insurance. So whether it's a first opinion or second opinion, it doesn't matter. We're not in network. So it just depends, but there's nothing inherently different about a second opinion that will affect coverage. Anything else? Are there any new research publications on endo that are open to the public? Um, there are so many resources for papers. There are academic societies, there is Google Scholars, there's PubMed. So I would just search on those for the latest articles on endometriosis. And not all of them provide free downloads with the full article, but some do. So you just kind of have to search around. There's no like one resource at this time that provides full articles. All right. So I'm Dr. Prabakar. I'm a board certified gynecologist. I'll have a fellowship in minimally invasive surgery. So we do a lot of robotic and advanced laparoscopic surgery. I'm in the Bay Area, in the San Francisco area. So I own my own private practice where I provide boutique gynecologic care for women through all phases of life. So our youngest patient is 9 and our oldest is 96. So everything in between we see and we help women with. So if you are in the Bay Area, you're looking for a gynecologist, maybe you're looking for a second opinion on something, come see me. We can see you the same day or the next day. We have lots of availability, and we spend about 45 minutes to an hour with each patient. So no one is leaving our office thinking, oh my gosh, I have so many questions that I did not get to ask. That is just not happening in our office. So please make an appointment. If you're anywhere in California, you can see us virtually because we are licensed, all through California. And if you're not in California, maybe you're in New York or maybe you're in Asia somewhere, and you just want somebody to walk you through some of these things, not as your personal doctor, but just to get all the accurate information. We're happy to do that via a coaching session as well. So you can contact us to find out more. And this was so much fun. This is one of my favorite topics. Thanks for tuning in. Please tag or share with a friend who can use it. And I will see you guys next Thursday. All right. Bye. See you later.